Hi, this is the Tuesday edition of Case of the Day, and we have the 65th case, NTM, when both types coexist. This is a 50-year-old with Mycobacterium intracellular infection, diagnosed a year ago, but with lung disease for 3+ years. So it took a little time for the diagnosis to happen. Patient has fibrocavitary disease in the right upper lobe and in the left upper lobe, but more in the right. And then the right middle lobe, lower lobe, lingula show tubular bronchiectasis, peribronchial thickening, branching centrilobular opacities, and nodules. You can see the difference here in the coronal images. In the mid and posterior aspects, we see the fibrocavitary disease, and more anteriorly, we see the bronchiectasis and nodules. Now, these findings in our country can occur with standard Mycobacterium tuberculosis, but this patient had lingering disease over 3 years and was culture proven to be Mycobacterium intracellulare, which is a part of the Mycobacterium avium complex, or MAC. And this paper from 2022 has this nice table differentiating slow growing from rapid growing NTM species and the different ones that we see in practice. The patient had multiple scans, and if you see from December 22 to Feb 24, there was minimal progression, if at all, and then there's been significant progression between Feb 24 and July 25. So let's say over about 14-15 months, and we can see that the middle lobe disease, the lingular disease, the lower lobe disease has progressed, and the fibrocavitary component has also increased. My go-to paper for NTM is this radiographics paper, which came out earlier this year. And this is actually a slide presentation, so you would have to download the entire presentation and then look at it. But it basically talks about two forms of NTM lung disease. You have the fibrocavitary that you see here, the nodular bronchiectatic, which is the bronchiectasis and centrilobular nodules, and mucoid impaction with discrete nodules. This is again from that 2022 paper that lists the diagnostic criteria, but you do have to have a high index of suspicion. And radiologically, when we see lingering cavities and patients with tubular bronchiectasis and mucoid impaction, especially mid and lower zone, and the CT scan, on the CT scan, the patient looks cachexic or asthenic. In the elderly, we should think of NTM. This patient therefore has both forms, that is fibrocavitary and nodular bronchiectatic, and the disease is progressing. So this is how we suspect NTM, as I mentioned, when we are reading our CT scans in the elderly and in nutritionally compromised or cachexic individuals. For example, here is one such patient. You can see there's hardly any fat here. And you see right middle lobe and lingular disease with bronchiectasis and some bronchopneumonia and centrilobular nodules. And this was also unchanged over a month, but it was unchanged for almost 7-8 months with another CT scan earlier, which I don't have right now. This is also called the Lady Windermere syndrome, and maybe you all can read up about it. But I will, the next time I see something similar, I will probably put up a post or talk about. That's my WhatsApp channel. Thank you so much for viewing this.